One in there. All right.
Is this working? I saw Miracle. I think I have everything working in here. Thank you for your flexibility. Did anyone go to the other room and find it? Did you say this is your favorite room? I do too. I was just saying how much I love this room. These windows are huge. My goodness. It's so nice in here. Thank you for joining me here. Excited to talk about vitamins and minerals. All right. I feel like there was maybe something else I needed to share, but I don't think so. Oh, and this clicker, it looks like the last person left it on, but by God's grace, the battery is still working for us today. Oh, this is great. This is great. What is it? I am recording. Thank you. Yes, I had the people in here remind me to record. So we have our friends at Legislative Day. We don't want them to miss out just because they're representing the pharmacy industry. All right, excellent. So let's talk about vitamins and minerals. How many of you guys work in the community pharmacy setting that show up in? Hi and proud. How many of you have had someone ask you about a vitamin or mineral? Yeah, I did. From my experience in the community setting, because when I was in their shoes, I worked at Harris Teeter Pharmacy as an intern. And I felt like patients asked more questions about vitamins, minerals, supplements than they did about their prescription medications. I don't know if you guys feel that way, but lots of questions came up about vitamins, where to find the vitamin, what vitamins are recommended. So today we won't necessarily answer all of your vitamin questions, but we'll hopefully give you enough information that you can seek some of this out on your own. And in I think 2 weeks, we'll talk about resources specifically for vitamins and supplements that you can use to help answer your drug information questions. All right, so objectives. These are what we use to write our exam questions. We are going to identify populations that are at risk for vitamin and mineral deficiencies. So we'll highlight those along the way. We'll describe some general signs and symptoms. Don't get too hung up on this. I'm not going to ask you to describe all the signs and symptoms of vitamin deficiencies, but I'll kind of highlight the ones that are most important for you to recognize. Describe some of the management for these vitamin deficiencies. I'm not going to be testing you on doses. To be honest, I would have to look up doses for vitamins and minerals in a specific type of deficiency. And then we'll talk about some side effects, some toxicities that can occur as well. And then lastly, identify some populations or risk factors for this. So you are going to see a theme that diet plays a huge role in vitamins and minerals. And actually, if you're following the recommendations for diets for the US general population, you very likely wouldn't have a deficiency in any of these vitamins and minerals. And in the US, deficiencies of vitamins and minerals is very, very rare. So it's not something that you will encounter a whole lot here. So I think that's one overarching thing to keep in mind as we go through this. Because you'll see a lot of people supplement high doses of vitamins, just kind of on their own for general wellness. But a lot of times they're not actually deficient in those things. So keep that in mind. A lot of you probably take some vitamins and minerals. If you were thinking you were coming down with the common cold, and you're taking what's something you kind of hear about people using for the common cold to prevent that? Vitamin C, right? Yeah. So very likely you guys have taken these, or your family or friends have taken these. So we'll talk a little bit about the evidence, but we'll actually delve more into that when we talk about drug information resources. You'll see a dietary reference intake range. I don't list this for the vitamins and minerals. I think, again, it's not something I'm gonna have you memorize. But when you are looking up the recommendations for the required intake, that's what that stands for. A lot of times the supplements will have that on there. And this varies by people's age, gender, and then other conditions that they might have. So some risk factors for deficiency. Bariatric surgery is probably one that as a pharmacist you would encounter. Generally, when people have bariatric surgery, they'll actually meet with a nutritionist and they'll talk about specific vitamins and minerals that they need to supplement. And so that's something common. They wouldn't often get these over the counter. They're not generally prescription. And so they might ask you as the pharmacist for some help with this. You'll see that there's a hyperlink to this. And it actually takes you to the Mayo Clinic website, and they have a really nice article on their recommendations for vitamins and minerals. Let's see here. And we'll kind of highlight as we go through which vitamins and minerals are recommended in that case. Sometimes some different GI, oh, yes.
How do you feel about using natural medicines like the database?
Oh, I love natural medicine. So the question is, how do I feel about natural medicine? I love natural medicine. Yeah. And we will talk, once we do our drug information resources, you will see how much I love it. We will all practice it. You'll be like, wow, I've used natural medicine since I was in P1. And I'll be like, wow, that makes me sad. We will rectify that together in 2 weeks. I love natural medicine. GI disorders. So if people have pancreatic disease, they might need to supplement some of these. It can put them at risk of not absorbing some of these vitamins and minerals. IBS or irritable bowel syndrome also kind of affects absorption of some of these things. So a lot of times they'll need to supplement specific vitamins and minerals. Short bowel syndrome. So this is when they've had part of their bowel removed. So if you have, where do we do a lot of our vitamin and mineral absorption? Yeah, the stomach, the intestine. So if you have part of your intestine removed, then you'll likely have some problems with absorbing some of these vitamins and minerals. And then medications. We'll kind of highlight some of these along the way, but can anyone think about some disease states with medications that affect vitamins and minerals? So anemia can result from deficiencies, absolutely. Any medications that you guys can think of? Just in general, like medications that you know are associated with reductions in some vitamins and minerals. Yeah, pantoprazole, PPIs. Yep, levothyroxine doesn't typically lower the levels, but you're right, that's a really great point that vitamins and minerals can interact with some of our medications, so they'll bind levothyroxine. Yeah, so our P3s, I know you guys have seen more of this in therapeutics than our P2s, but you're right, so PPIs decrease absorption of a lot of things because they are reducing that gastric pH, and some of our vitamins and minerals need a more acidic environment. We'll kind of highlight those along the way. How about our P3s? We talked about levothyroxine can interact. Is there any medication commonly used for diabetes that you can think of that often leads to a deficiency? I didn't super emphasize it in the so you may or may not remember. Metformin. Does anyone remember what metformin commonly decreases? It is B12. I'm shocked because now that I think about it, I'm like, I don't know that I mentioned it a whole lot. So malabsorption can be affected by all those things we discussed about, and then malnutrition you'll see is another risk factor that's going to appear again and again on the slide. All right, so as we go through, we're going to start with our fat-soluble vitamins. And then we'll talk more about our water-soluble vitamins. So did you guys already learn? Are you guys already familiar with your fat-soluble vitamins? Or no? Yeah, some familiarity. I don't know, I can't say that word right now. So A, D, E, and K are fat-soluble vitamins. And I do think this is important to know off the top of your head. Because the fat soluble vitamins are the ones that you have to be a little more careful about. Because if you have too much of these, often they will result in toxicity. The fat soluble ones, you may have kind of heard, well, oh, excess vitamins, you'll just pee out those extra ones. And that's true for most of the water soluble vitamins, but not for our fat soluble vitamins. So I do think it's important to know off the top of your head, like which ones are our fat soluble vitamins, because there's only 4 of them. So A, D, E, and K. And then we've got our water soluble vitamins. So these are all of the B12s and then biotin, which you might have it as vitamin H, or you might hear it as vitamin B7. Yes. Omega-3. So omega-3 is like a fish oil, is typically like a fish oil derivative. So you guys will talk a little bit more about that when you do dietary supplements with Dr. Moody. So it's not really a vitamin or a mineral. That's a great question. So omega-3. It is a fat though. So I guess, yeah, so that's a great question. Okay, so let's actually dive into some of these. And we'll do a few knowledge checks along the way here. So which of the following is a risk factor for vitamin deficiency? Those for obesity. So it's not necessarily obesity, but what do we say that might happen in this context that would be more of the issue? Bariatric surgery. So obesity itself, not really a risk factor. But if they have bariatric surgery, they typically will have to get those fat soluble vitamins supplemented. They're normally recommended to take a multivitamin, and so they have a very specific regimen that they're actually recommended to do for life, but not obesity. How about excessive alcohol? Yes, you guys are gonna see this over and over again. Why do you think that is such a key risk factor? Oh, yeah, the liver, that's not what I was thinking, but that's a good point, because some of these things are stored in the liver, so if you had some liver inflammation, that could potentially affect that. Some other things are just diet, so if someone is maybe not eating a balanced diet and having mostly alcohol, then they're just not getting those in their diet. And then also alcohol can just decrease absorption of some of our vitamins and minerals. So kind of a couple different mechanisms. Well, balanced diet. Yeah. Cardiac surgery. Not necessarily. We talked about bariatric surgery because that actually shortens the intestine. But other types of surgery are not generally a risk factor. You guys next week are going to talk about orlistat. So I know you guys haven't really learned much about it yet. Does anyone know what that's for? For what? For weight loss. Yep. So you guys are going to talk next week with Dr. Bailey about orlistat. Does anyone know how it works by chance? Yeah, it interferes with absorption of fat. And so then which vitamins do you think it's going to interfere with? Our fat soluble vitamins. So let's review those. A, D, K, and E. Excellent. All right, and then pregnancy. What do you guys think? Yeah, pregnancy definitely. I'm sure you guys are all familiar with prenatal vitamins. So a lot of times it's a hypermetabolic state. So they go through vitamins and minerals more frequently. And then there's increased requirements for them. Great. So those are all kind of populations where you might think, there might be some sort of vitamin or mineral that they're deficient in. So we'll start with our fat soluble vitamin A. You'll see this is essential for a lot of different things, growth and reproduction. I think a lot of people think eye health or eye view. I'm like really obsessed with eye health. I don't know if we've talked about that together, but I'm always having some sort of eye emergency. I'm surprised I don't take vitamin A, but I think I'm getting it in my diet. Also, we think a lot, if people are deficient in vitamin A, they'll have, a common symptom can be having difficulty seeing at night. That's included in here. They've got dry eye. So those are some common things here for vitamin A. So if you guys can pull these up and click this little resource here, let's do some self-exploration to see some foods high in vitamin A. Because as a general rule, we would rather improve our diets to make sure we're getting adequate requirements versus taking a vitamin A supplement or one of these other supplements. It's been shown that generally getting these through diet is better absorbed and more efficacious. So one of the things I like to counsel on is getting a wide range of fruits and vegetables. I feel like when I walk further, it gets kind of that loud, does it? No? Yeah, I feel like weird things happen. Maybe it's just me. All right. Is that internet working? So, working for some people. Intermittent. This is the one bad part about lunch and food, or maybe just the school in general. Yeah. Even at my practice site, sometimes we won't have internet for the whole session. I don't know. Internet's a strange thing. I think 2024, that's what a conference but alas, we haven't. All right, for those whose internet is working, what are some foods high in vitamin A? Cantaloupe. That's unfortunate. I don't care for cantaloupe, but thankfully there's other things. What else? Sweet potatoes. Those are delicious. Okay. Other things. Carrots. Wow. Are we seeing a trend here? Eggs? That breaks our trend. There's a lot of orange things. And in fact, if you eat carrots, you actually can get an orange tinge. My mom used to eat an excessive amount of carrots. And I was like, Mom, you have got to cut that back. Because you're looking a little orange. I don't know if any of you guys watched Patrick's School Bus when you were children. Yeah? Oh, this is great. I thought maybe that was like before your time. I think maybe some of you it is. But it had an episode on it. All right, so here's lots of different fruits and vegetables and eggs, some nuts even, that are high in vitamin A to help our eye health. All right, so which of the following is a function of vitamin A? Is it involved in parathyroid hormone, clotting factors, bone formation, or normal growth and reproduction? Yeah, normal growth and reproduction, and eye health. All right, so vitamin D. For those that are P3s, we've talked about vitamin D. Under what disease state do we talk about vitamin D? Osteoporosis. So vitamin D plays a key role in our bone health and bone formation. There's two main types of vitamin D, D3 and D2. D3 is cholecalciferol. This is the naturally occurring vitamin D that gets activated by sun exposure. And actually, most of us get adequate vitamin D just from sun exposure. It doesn't take like an excessive amount of sun exposure to get this. But we'll talk about some risk factors for this. And then there is D2 or ergocalciferol. This is the one that you guys commonly see in the prescription products, like that 50,000 units that people take once a week is generally that ergocalciferol. It's not as well absorbed. Actually, the D3 is preferred in the osteoporosis guidelines because it's better absorbed. If they take all 4 pills of vitamin D, or okay. So if they're on the 50,000 units and then they take all 4 of the 50,000 in one day. Okay, so the question is, what would happen if you took all your 50,000 vitamin D? That, I have never seen that happen, but I can see that happening. I don't know. I would have to look, you can get too much vitamin D, and it is fat soluble. So, like, people that take an excessive amount of vitamin D, like, we can check their D levels, and it can get out of hand. So I don't know, doing that one time, like, how dangerous that would be. It could definitely be way too much, and they can have side effects from it.
Say if a very high dose of vitamin D that will damage the kidney.
Oh, kidney damage?
So because of that, during the COVID, many people taking vitamin D, but then after they say if the level didn't exceed the 75, it will not damage the kidney. So if 50,
Yeah, that's a lot of vitamin D if you took all four at once. Have you had that happen?
Not to me.
Not to
but
you.
In the pharmacy, somebody's called and said like they ran out.
Yeah, I'm actually surprised I haven't seen that more often, because it seems like that would be a common thing to happen. I've definitely heard of people having vitamin D toxicity, but like that exact scenario, like how dangerous that is, I don't know. I'll look in the break and see if I can find anything conclusive on it. I would definitely think, let's take this as like a counseling pearl though, as we're pharmacists, people are picking up their 4 gel capsules, a very pretty blue vitamin D2, be like, one a week. There's only 4, use conservatively. Because it is not something that they would just pee out, so you could potentially have some issues if you took all 4 at one time. All right, so let's see here, we talked that already, that we need to talk about this in osteoporosis, so you'll revisit this again then. Risk for deficiency. So chronic diseases often result in vitamin D deficiency. So chronic disease such as renal failure or hepatic failure, these interfere with the conversion of vitamin D into its active form. So that's why it's common with those. Just if you're never outside, then you won't absorb any vitamin D. Darker skin pigmentation also has lower absorption of vitamin D. Irritable bowel syndrome, I don't know that they quite know why this is, but they found that in trials that people with irritable bowel syndrome have lower levels and are often low in vitamin D. And their weight loss surgery, we talked about that, takes out some of the intestine, and then so they just have poor absorption of the fat soluble vitamins. If someone is deficient in it, it is called typically Ricketts disease. And then deficiency in it can also lead to osteoporosis or bone density. Oh no, did my clicker give out on me? This is so sad. Oh no, it's too good to last. All right. Surely, okay, just, I don't know, user error for a minute. Okay, so vitamin D here, you can pretty much use D3 and D2 interchangeably. Which one did I say was more preferred? D3, better absorbed. So if someone is low in vitamin D, there's all kinds of different dosing. I would look it up pending what the level of their vitamin D was. But a lot of times it'll be supplemented with just 600 to 800 international units. We have some different recommendations in the setting of osteoporosis, so I'll refer to those for patients with osteoporosis. Vitamin D, sometimes people will do the weekly dose. That's not generally preferred any more than just taking an over-the-counter daily dose. So a lot of our patients will just take 1,000 or 2,000 international units once a day, and that's generally just as good as the 50,000 once a week. So you'll see a lot of different dosing for vitamin D, and part of it will depend on their vitamin D levels and what they're treating. You can get both D3 and D2 over the counter. I don't think I ever see D3 prescribed, but D2 can be prescribed sometimes. All right, which of the following is a cause of, or risk factor, maybe not cause, of vitamin D deficiency? Dark pigmented skin. Yes, it can decrease absorption. How about pregnancy? How about weight loss surgery? Yes, it's a fat soluble vitamin. Alcohol, excessive alcohol use. Not generally, but chronic renal failure and chronic hepatic failure, and then irritable bowel syndrome. Yes. Generally, they don't have poor absorption, so it's not typically something, it might be in your prenatal vitamin, but they don't generally need higher doses. Yeah, great question. All right, moving on to vitamin E. This is often considered an antioxidant, although really all vitamins and minerals can be considered antioxidants. You'll see that sometimes our premature infants are at high risk of vitamin E deficiency. Let's see here. This is, let's see here. Also seen in people that have like cystic fibrosis, where they can't absorb some of these fat soluble vitamins. But in general, vitamin E deficiency is pretty rare and can be treated with changing diet or supplementation. We'll talk a lot about different types of anemia that can result, though, in different deficiencies. So we'll highlight some of those along the way. And actually, vitamin E has an FDA approval for hemolytic anemia. So let's look for some foods high in vitamin E if our internet is working. Spinach, that one? I love spinach. Broccoli, well, vegetable oil, peanuts. What was that last one? Lots of good things. Yeah, we got avocados, oils, nuts, seeds, all high in vitamin E.
Vegetable oil are you referring to? Is it the vegetable oil you use in making stew? Vegetable oil.
Oh, so the question is it vegetable oil? It might be more specific types of oil. Let me see here. I have, yeah, vegetable oils are included. Yeah, well, it is a fat soluble vitamin, so a lot of these foods are those that are like higher fat foods. That's why it's our vegetable oils, our avocados, nuts, which are high in like our healthy fats and our fat soluble vitamins. Yeah, so good observations. Oops. Great, vitamin K. So this plays a huge role in our clotting factors and our good friends proteins C and S. Some risk factors for deficiency are liver disease, bowel disease, and actually, I think an interesting one is use of broad spectrum antibiotics. Does anyone know why those broad spectrum antibiotics might play a role here? Yeah, it's okay if you don't. I actually, when I was preparing for these, was looking at the mechanism, and it's actually because a lot of our gut flora is what breaks down different things to form the vitamin K. And so if you destroyed all of that gut flora with these broad spectrum antibiotics, that's what results in a lack of vitamin K. So this is something that can be seen in our neonates. And so they'll recommend vitamin K at birth for these little tiny children. What are some foods that are high in vitamin K? You guys probably remember this from, have you guys done your care lab? Or you might have done some counseling on this? Because what medication do we really, when we think vitamin K, we should always think this medication. Warfarin. Peaches, have you guys had your warfarin counseling care lab? Wonderful, excellent. So what do we counsel patients on warfarin about with regards to vitamin K? Stay consistent with what? What kind of veggies? They're carrots? They're green leafy veggies. So that's a lot of times what I think of when I think of vitamin K. I think of those green leafy vegetables. So spinach, kale. Other green vegetables have way smaller amounts of vitamin K. So like your broccoli, beans, things like that have small amounts, but nowhere near as much as those green leafy vegetables. So here's just a picture of different amounts. I'm also going to post these slides afterwards too. So if you're like wanting some of these pictures and things later on to study, I'm going to post this slide set. So I don't think these pictures are ongoing. All right. So we have finished fat soluble vitamins, and we are transitioning on to our water soluble vitamins. Our first one, vitamin C. So this one, again, a lot of these could be listed as antioxidants. So something that when these are marketed to patients sounds really nice, but again, really all these vitamins and minerals are antioxidants. Eating fruits and vegetables gives you lots of antioxidants. Helps with connective tissue, immune function. We talked about that's why people take this to prevent the common cold or to treat the common cold. Although unfortunately, like really well done clinical trials have not shown it to be hugely effective at either thing. However, probably not super harmful either, because if people have too much vitamin C, what do you think generally happens with this water soluble vitamin? Peed out. So this is one rarely do people have toxic effects with it. There are some populations that are commonly low in vitamin C. So smoking, sometimes our formula-fed infants, if people are not getting fruits and vegetables that are high in vitamin C. And then scurvy, what do you guys think of when you hear scurvy? Pirates, yeah, that's why I was thinking pirates, that's more fun than what I was thinking. I was thinking like people on long ship voyages, when they ran out of their citrus fruits, they would develop scurvy. Yeah, pirates, I like that though. So that's what people are diagnosed with if they have low vitamin C when it's severe. Those are the symptoms there for it. So those are symptoms of scurvy that our pirates might come down with. They did not pass adequate fruits to keep them healthy on their voyage. Scurvy is very rare here in the US, but if you did encounter someone with it, just 10 milligrams a day, which is a very low amount. If you had some fruits or vegetables in your diet, you would easily get multiple times that amount of vitamin C. Let's see here. And like I said before, generally, if you have too much vitamin C, so let's say you don't take, you decide, I know Dr. Cole said randomized trials don't show a huge protection in taking vitamin C because of the common cold, but I'm going to do it anyway. That's totally fine, because you'll probably just pee out any extra vitamin C. I know my grandmother, she takes a lot of vitamin C. I think she just takes it all the time. And I'm like, it makes her feel good. So if you don't mind paying for it and you aren't having any issues, take your vitamin C. Oh no, I showed this picture already. I thought I had hit it. So our P3s, we all wore the Freestyle Libre. I was going to have you think back to Care Lab P3 fall. But high doses of vitamin C actually interact with the EGN device, the Freestyle Libre, and can cause falsely high readings. My uncle, he takes like mega doses of vitamin C. And he wore the Libre, and you might have seen some highs. It didn't seem to have a huge impact. This is an N of 1, but it's something that when you set up your Libre, it has like 5 warnings about how this can interfere. So it's something when I set patients up with the Freestyle Libre, I ask them what they're taking for vitamin C. And I've had quite a few patients that just chronically take a lot of vitamin C. So it's a good question for us to ask, because none of us want our CGM numbers to be higher than they need to be. So I think that's something to keep in mind with all these vitamins and minerals, is they can interact. We talked about levothyroxine being something that interacts quite a bit with calcium, and some of the other products here, and vitamin C can even interact with some of our devices. What are some foods high in vitamin C? Kiwi. I love kiwi. Those little seeds in there are so crunchy and delicious. What else? Oranges? Yeah, I classically think of citrus fruits. What other things? Vegetables, a lot of vegetables. Other things. So lots of things. We have the beautiful kiwi, guavas. Do you guys have a lot of guava in Puerto Rico? Yeah, I had some delicious guava related things when I was there. Yeah. Peppers, some of our green leafy vegetables. Such a variety of delicious things containing our vitamin C. All right, B12. This is another one that comes up often. People often take B12. People take it orally, or they'll get injections of B12. When I practiced in Tennessee, at the pharmacy, we would give B12 injections without a prescription, just over the counter. Isn't this odd? I've never seen this done anywhere else. Has anyone seen this? We don't do it here in Maryland. Have you seen it? Where people come in for over-the-counter B12 intramuscular injections at the pharmacy? Where have you seen it? They do it at Puerto Rico? Oh, this is so interesting. Other Puerto Ricans have seen this? No. This is a special offering at your pharmacy in Puerto Rico. I see. Yeah, we would give these all the time. I did a community B2by1 residency with Kroger, grocery store chain. And we had people come in all the time and would get intramuscular over-the-counter injections of B12. They didn't, so it's pretty safe. You know, they didn't have any lab work that they were deficient in B12. They were just getting this willy-nilly. So some things that could put people at risk. So conditions that affect the absorption. Actually, vegetarians, we'll talk about the kind of foods where you find B12 in a second, and that will make sense. And then certain medications. We already talked about this, but just to review, what's like one of the most common medications that causes B12? Tanya already told us. Metformin. Metformin and PPIs often used too. So even just being on metformin for a couple months can result in B12 deficiency. It's not everyone, and we actually don't even routinely check B12 in people that are on metformin unless they're having signs and symptoms of a B12 deficiency, which oftentimes is like kind of neuropathy type symptoms can sometimes lead you to check a B12 level. So some reasons that we would use B12 is to treat pernicious anemia or B12 deficiency, just blatant B12 deficiency. Pregnancy, if someone has cancer, or actually bariatric surgery, they often will need lifetime supplementation of B12. You can do oral or intramuscular. I don't think there's evidence that intramuscular is any better than oral, but sometimes patients prefer that. I think at our clinic, people can come in for like a nursing visit and get intramuscular B12. And like I said, I used to give it all the time. It was like a flu shot. You would give it intramuscular in the arm, just like a flu shot. Yeah.
When they get that, how long is it for? Like, is it like a monthly, like days for the shot?
Oh, if they're getting intramuscular B12? So if they actually have low B12, it would kind of depend. Like, do they have a condition that would be treatable, or so it would kind of depend on how long they would be treated, depending on what that issue is. Like in the circumstance of someone that's had bariatric surgery, they have to do B12 long term. If someone was on metformin and had low B12, as long as they're on metformin, they would have to do supplementation. Yeah, great question. All right, so here are some foods high in B12. What do you see as a common theme here? Yeah, there is a lot of seafood. Other common themes. Yeah, their proteins are their meats. So that's why our vegetarians, often if you're vegetarian, you actually have to take a B, or you're recommended to take a B12 supplement, otherwise you are low in B12. Okay. So next here we've got folic acid. This is something I think we commonly think of, especially, I guess, with pregnancy. So something that would be in those prenatal vitamins. And this is to reduce the risk of neural tube defects. So this is something really important in pregnancy that all pregnant women generally will take a folic acid supplement. You'll see it's also used to treat different types of anemia. So that's another thing. And then metabolic states, so hypermetabolic states. Can anyone, RP3s, in endocrine, we talked about one hypermetabolic state. Can you guys remember a state where the metabolism was kind of ramped up? It wasn't diabetes. It wasn't men's health. It wasn't osteoporosis. Yeah, so it's hyperthyroidism. Yeah. Some causes here, a lot of the similar things that we've seen on other slides. So alcohol, again, because they're not probably getting it in their diet. I think alcohol also reduces absorption of folic acid, so it's kind of two things there. You'll see liver disease again. Just not having a diet that has this in there. And then methotrexate. So none of you guys have done oncology yet, right? Maybe not. You have done it. Yeah, when did you guys do oncology? Remind me. Peach spring. Okay. Bless my heart. You would think I would have the PG sequence memorized, but I definitely have to look it up all the time. So methotrexate. So aside from oncology, what do we see methotrexate used often for? Yeah, sometimes for some autoimmune skin issues. Arthritis. Yep. So often can be used as an inflammatory for arthritis and some autoimmune diseases. So used a lot outside of the oncology world. And so a lot of times we'll recommend folic acid with patients that are on methotrexate to reduce the side effects from methotrexate. So for those protective effects. So folic acid, if people do not have enough of that, they can have these different symptoms here. Deficiency is typically treated with 1 milligram a day, although if patients are on methotrexate, generally they'll have 5 milligrams once a week that they'll take maybe after the day after their weekly methotrexate dosing. So you'll see different dosing, but a lot of times it's 1 milligram a day. And then there's the recommendation for women of childbearing age. Again, I'm not going to test you on the dosing because I think you can very quickly and easily look that up. And we got foods with folic acid. Kind of a general theme here. We're seeing a lot of fruits and vegetables. So in general, unless you're pregnant or you're on a medication that requires higher levels of folic acid, we get a lot of this in our diet. So these, in addition to fruits and vegetables, what are some other things that are often supplemented with folic acid? What was that? I wasn't thinking iron, but other foods that are supplemented. Or fortifying, maybe would be the word to use. Fortifying. Cereals, yes. If you look at the label of cereal, it's like practically a multivitamin, isn't it? Yeah, cereal is not necessarily a good thing, but they have it fortified with a lot of vitamins to help kind of prevent these deficiencies. So cereal, what other things? Yeah, so kind of in addition to cereal, a lot of like flours and breads are fortified and pastas too. So they'll add folic acid to these things. Okay, let's see here. So on to niacin. So this used to be used so commonly. Actually, when I was in pharmacy school, which sadly was a really long time ago now. I think the tears in my eyes. We would recommend over-the-counter niacin right and left. You know what we use it for? You guys probably barely talked about it in cardio. But there was something for cardio that we like highly recommended niacin for. I think I heard cholesterol. Yeah, so it's very common if you have your patients come in, you ask them what vitamins and minerals they're taking. Very commonly, patients are taking niacin, because we actually used to go out of our way to recommend niacin, especially to improve our HDL cholesterol. This is no longer recommended by the cardiology guidelines. We'll talk about some reasons why here in a second. You'll see that if someone is deficient, they can be diagnosed with pellagra, and we'll talk about that on one of the subsequent slides. But here are indications for supplementing it, and you'll see that hypercholesterolemia and hyperlipidemia are listed there. So pellagra, has anyone ever seen this? I've never seen it. I don't know. I'm an outpatient, so I'm in like a family medicine office. So I don't know. This is like a medical emergency, so they should hopefully be in the hospital. So if they presented to us with this, like we would send them over to the hospital. So I've never seen this. I think probably fairly rare here in the United States. But pellagra is a life-threatening condition and results from deficiency of niacin. And commonly the 4 Ds are used to describe it. So I painted a picture of a clinical case of someone with diarrhea, dermatitis, dementia, and hopefully they haven't died yet in the case. Then you might be thinking, oh, maybe they have a niacin deficiency, and this is consistent with pellagra. This is most often seen with alcohol abuse, but you'll see that there are some other associations as well. And they will be treated with niacin or niacinamide. So transitioning from pellagra to using niacin for hypercholesterolemia or high cholesterol. You'll see the doses here, are they higher or lower than in pellagra? They're a lot higher. So I think that's an important thing to note. If you do have a patient that comes to you, or you have a family member taking niacin, and they're just taking, let's say, 500 milligrams a day, and they tell you they're taking it for their cholesterol, it's probably not having much impact at all on their cholesterol. So I think that's an important thing to note. When we would recommend niacin for patients, they would have to take 1 to 2 grams, and they'd have to take this 3 times a day. So it was a lot of niacin. So it's kind of nice that we're not recommending this anymore to reduce pill burden. There's a lot of fun counseling pearls for niacin. I think some pharmacy schools would actually have their pharmacy students take an over-the-counter niacin tablet. Has anyone ever taken one before? Not a soul. No, you have. Can you share what you experienced? Yeah, really warm. So thank you, Justin. Yeah, so really common side effect of IR niacin is flushing. And actually, we would recommend patients take a 325 milligram of aspirin or some ibuprofen 30 to 60 minutes before taking niacin to prevent that. I say used to because we just generally don't recommend taking a niacin supplement now. Yeah.
If the patient have a pain from a statin for a long time, is niacin will be a good alternative for the patient?
That's a great question. So the question is, if someone was statin intolerant, would niacin be a good second line option? And I definitely see that train of thought. It's not currently recommended by the American Association of Cardiologists or the American Heart Association. Part of that is due to added toxicity risk and the fact that it hasn't been shown in trials to have any cardiac benefit, and in fact might have some cardiac harms. So if someone couldn't tolerate the statin, let's review from cardio. What would you recommend instead? Ezetimibe, generally, you'll do ezetimibe, or if they're very high risk, you do a PCSK9 inhibitor. Am I saying that acronym correctly?
Yeah.
PCSK9 inhibitor. No, I said it wrong. I could really put some thought into that one. I don't know. Which those are getting to be quite a bit more common. Yeah, so I generally would not recommend niacin. I haven't recommended niacin in like maybe 10 years. It's been not recommended for a long time. And that's due to some of these toxicities, which are specifically with niacin, not with niacinamide. And niacin is what we would use for cholesterol, not niacinamide. So there's a lot of GI issues with niacin. It's associated with liver toxicity. And then this is not like a reason we don't use it, but we talked about that flushing is really common with it too. So we used to recommend sometimes people do the ER formulation because it has less flushing, but the ER formulation is associated with more liver toxicity, so it's generally not recommended. So there's also prescription niacin called Niaspan. Do you guys see this dispensed often? We used to dispense it all the time, but hopefully everyone is updated on their cardiovascular guidelines and are not doing that anymore. So do keep in mind that there are some significant side effects with niacin, and that is why it's no longer recommended. B6. Okay, so you'll see here, immune function, lots of other different functions here. You'll see some very similar causes for deficiency. Maybe one thing that we see new that we haven't seen before is isoniazid. That's typically used in the hospital, not outpatient. So this is not something that I commonly see us needing to put patients on outpatient. It could be something that you would see more if you did things in the infectious disease spectrum. Let's see here. Other things to really point out about immunity deficiency. No. Thiamine. Let me also see. Okay. We'll take a break in like 8 minutes. So thiamine or B1. We'll talk on the next slide, but this is something that's definitely very common. Like when I hear thiamine, I think this is a severe issue, especially in patients that have alcohol use disorder. So that's probably the number one thing, especially here in the United States, that you would see a thiamine deficiency for. You'll see there are some other uses, including furosemide. So what do you think happens with furosemide? What do you think the mechanism of that is? Yeah, just excretion of, so they would just urinate out any extra thiamine. And so a lot of times if I see someone's on furosemide and I see that they're depleted in a vitamin or mineral, I'll kind of do some investigation. But thiamine can be a result of furosemide. So patients with heart failure that are on a lot of furosemide have this issue. But when you have more, generally this encephalopathy is not associated with furosemide dosing. It is almost always due to chronic alcohol use. This is definitely something that would be fair game for the NAFLEX. Here is a common kind of NAFLEX type question is what if someone was diagnosed with Wernicke's encephalopathy, which vitamin would they need? And the answer would be thiamine. So in this encephalopathy condition, they would have altered mental status, which is not a surprise since they have encephalopathy. They might have some eye issues. They might not be able to walk straight. And then this is generally an acute issue that is corrected when you treat them with thiamine, so it's reversible, but can result in this Korsakoff syndrome, which is more of a chronic type of condition. So generally, if people are treated with this in the hospital, they'll receive IV thiamine for several days, and this can be reversible. We don't generally use oral thiamine to treat this condition because it's pretty serious, and we will give them IV therapy. Beriberi, there's two different kinds of it, as you can see here. We have the dry and the wet. This is also a result of thiamine deficiency. I'm trying to think of that movie. There's like a movie about, I don't know, it's escaping me. But this can be something that's also a result of thiamine deficiency that you could see in refugee camps and things where people are not having enough of the different vitamins and minerals that they need. Maybe they're only given like one type of ingredient to eat. You can see them come down with beriberi. The dry is more of a peripheral neuropathy, like nerve type condition, while the wet is more cardiovascular related. And so this too would be treated with thiamine replacement. So if you see anything about beriberi or you see anything about Wernicke's encephalopathy, know that they are deficient in thiamine and that needs to be replaced. All right, B2. Let's see here. Exciting things about B2. There's really not a lot of exciting things to mention about it. You'll see under the signs of deficiency, it's a lot of different inflammation. So just inflammation of different parts and linings of the body. This is very rare, unless, because most people get enough B2 in their diet. Biotin, this could be referred to as vitamin H or vitamin B7. Deficiency of biotin is also very rare. I think kind of a fun fact is people that eat a lot of raw egg whites can be deficient in this. I don't know, do any of us eat a lot of raw egg whites? Yeah, some of us. So the raw egg whites have some sort of ingredient that interferes with the breakdown and activation of biotin, and so that's what results in this deficiency. You'll see that there's some symptoms there for being low in biotin. And so a lot of times biotin, one thing that I wanted to mention here with all the B vitamins is it's not too uncommon if someone's deficient in one that they would be deficient in multiple. But especially if it's a malnutrition type of scenario. All right, so we'll break here, and then we'll finish up with minerals. So I will break.
Okay. Ay, sí, ¿verdad que tú nunca has ido presencial y me que es una oportunidad? No, porque era como que era una hora de teatro y además pero me da ay, me preguntaron cómo me debo tomar la vida y yo la Pero la nevera. Mira que a mí me tocó. Bueno, ¿cuál era el? Bueno, había gente. No, no, el mismo. Y yo, mira, yo voy a me llama Diego porque yo así yo. Y yo me por el iPad, por el iPad, por el iPad. Yo cuando llegamos voy a llamar. Tampoco. Bueno, pues, tampoco.
Restarting with just a quick dash through minerals. I don't have a lot of added to say about minerals. I do want to follow up though on our vitamin D question from the first hour. And that was a fascinating question, and I'm surprised that I've never been asked that before. I can see that happening quite often. All right. So the question before was, what if someone gets their little vial of their vitamin D, 50,000 units, and takes all 4 at one time? I think that I would be okay. From what I was looking at, there's been even some studies in taking large doses like that. I think if they continue to do that long term, then that's when they would have what you had mentioned, like some kidney issues, and there's other things that can happen as well. if they have really high vitamin D levels for a long period of time. But if they just did it for like a couple of days, or just did it as a one-time thing, I think that they would be okay. After they were to do that, it does take a while. Like if someone's low in vitamin D and you start them on a supplement, like you would wait several weeks before you would recheck it. So it's not something that would be impacted like super quickly. But I bet in that case, like if they check their vitamin D levels in a few weeks, like I doubt that one incident would cause it to be like sky high. But if they were to do that for several weeks or months, then that's when like people can even go into a coma and they have very, very high vitamin D levels. This is not something that happens often. But I mean, a great counseling factor for pharmacists. More is not better. Almost all of these things. On vitamin D, one other thing that I wanted to point out is historically it's been reported in international units or IU, but they've actually, as of maybe 4 or 5 years ago, the FDA now requires that all the vitamin D supplements have different dosing. So let's go back to that real quick because I did want to point that out to you. Oh, vitamin D, where are you? Especially because you'll probably see a lot of patients asking you about vitamin D. Okay. So you'll see that I listed things in international units as well as micrograms. The FDA now requires that all the supplements report the amounts of vitamin D in micrograms, which is how we do everything else. I'm not sure why vitamin D was in international units. They thought this was not as easy or safe for consumers. So there's been kind of a transition from international units to micrograms. So you'll hear patients and providers still say international units quite a bit because that's just what was most commonly discussed. So normally the bottles now will have both. If you're trying to calculate them, if you just multiply 40 times the micrograms, that is the same as the amount in international units. That was just another thing I wanted to point out here. Yeah, great questions. So this is probably one of the most common things that you guys will see patients ask you about and will want to supplement. Okay. Moving back. Okay. One thing I wanted to share that I didn't share about this one. No. Okay. Okay. All right. So starting with one of my favorite vitamins and minerals, calcium. So again, P3s, where did we talk about calcium before? Osteoporosis. So calcium is another key component. It's mostly in our skeletal system. Not sure what to call that. Organ, skeletal system. So it plays a huge role in that as well as many other pathways in the body. Reasons for deficiency could be hypoparathyroidism. Vitamin D and calcium aid each other in absorption. So sometimes if someone's deficient in vitamin D, they'll be deficient in calcium. End-stage renal disease can also be a risk factor. You'll see that that's a risk factor for deficiency in a lot of things. Just not getting enough calcium in your diet. So that's where we get most of our calcium is in our diet. What are some dietary things that you think of when you think of calcium? No. Yeah, so dairy products. They're not the only source of calcium, but they are a major source of calcium. So if you are lactose intolerant and don't eat any dairy products, then it can be a little bit trickier to get your calcium through diet. And then weight loss surgery can also result in lower calcium absorption, and so often they will need to supplement calcium lifelong. Yes.
Yeah, so you say like you take it, right?
So the question is, if we ate our chicken bones, would we get calcium from them? Off the top of my head, I would say probably you would. Is that a safe way to get our calcium? I don't think so. I think it's not really recommended. I feel like it could puncture something. I wouldn't recommend getting it that way.
What some people do is, you make a broth.
They make a broth with the bones.
Yeah.
Yeah, I don't know how much calcium gets absorbed by the broth. That's an interesting thought. I would definitely, I'm not sure about that. But I wouldn't suggest eating your chicken bones as getting your source of calcium. Let's see here, treatment. So if someone is low in calcium, the body typically can't absorb much more than 500 milligrams at a time. So we talk about with osteoporosis, a lot of times they need about 1,000 or 1,200 milligrams of calcium a day. And we really encourage them to get most of that through diet if they can. So a lot of times you don't need to supplement the entire amount of calcium, and maybe 500 milligrams is enough for them. I told the P3s the story about my mom. She was diagnosed with osteopenia, kind of the precursor to osteoporosis. Started taking tons of calcium supplements, but she also changed her diet dramatically to add a lot of calcium in there too. I was like, Mom, I think you probably are getting all the calcium you need through your diet. There's a lot of online calculators if you're curious how much calcium you're getting. So doses more than 500. If you do decide that you need to supplement 1,000 milligrams of calcium, you'll want to split those so that it can get optimally absorbed. And then you'll see the max dose there. I'm not going to test you on doses, but I do think it's helpful to know off the top of your head as a pharmacist to recommend no more than 500 milligrams per dose. It can be toxic greater than 3 grams. So again, more is not better. This can result in developing kidney stones and hypercalcemia, as you would expect. So more is not better. There's been a lot of, associations in high calcium supplementation with different things like prostate cancer, cardiovascular disease, things like that. They're not super clearly defined, so I wouldn't say that I feel so strongly about it from this evidence that over supplementation is causing heart attacks and strokes, but there is some association with that. So again, it's recommended not to over supplement it. There are more types of calcium supplements than these, but these are the main over-the-counter supplements. We have carbonate and citrate. One is not any more preferred than the other. A lot of times carbonate is cheaper, but neither one are incredibly expensive. These are just kind of some pharmacy counseling pearls if patients are trying to determine which one to take. A lot of times if they're on a proton pump inhibitor, we'll recommend the citrate because it's better. The calcium needs an acidic environment to be well absorbed. So if they're on proton pump inhibitors or H2 blockers that are affecting the pH, theoretically the calcium carbonate is not as well absorbed. I do not think this is based off of a comparison trial that shows this, but I would say it is a common thing for pharmacists to counsel on. Another thing, if people let's say they already had a huge bottle of calcium carbonate and we're on a proton pump inhibitor, we could also just recommend that they take it with food or take it with something a little acidic like orange juice, and that can help with improving absorption as well. This has listed that calcium citrate might be associated with less GI effects, especially higher doses of calcium can be constipating. But this is kind of anecdotal. So it's not necessarily that one is a whole lot better tolerated than the other. Okay, calcium is so fun. A lot of times calcium and vitamin D come in combination products. And so that can be really helpful for patients if they're trying to supplement both of them. In fact, it can sometimes be hard to find them separately. This happened to my aunt. My family loves to take excessive amounts of vitamins and minerals, as you can see from my story. And my aunt was taking like tons of vitamin D, got her vitamin D level back, was like through the roof, as will happen with your fat soluble vitamin D. She did not have kidney failure or anything like that. It wasn't that high. She was not taking 50,000 international units daily. I don't know how much she was taking. Probably 1,000, 2,000 a day. Didn't need that much. And so then she was looking for calcium by itself and was having all this trouble. So sometimes it can be hard to even find them separately. All right, iron. Whenever I see patients on iron, I feel a little bit sad. Anyone ever taken iron? It's like it's a tough thing to take. Has a lot of side effects. A lot of times people are, why are a lot of people on iron? Or iron deficiency anemia. So it is a relatively common thing for people's prescribers or doctors to recommend that they take iron. So you'll see a lot of patients come to the pharmacy looking for iron supplements, and they were recommended by their doctor. You can get a lot of iron in sources like meats, proteins. That's really the main source of iron, although there is some in some of our enriched foods and our green leafy vegetables. Common causes, so it's not uncommon, especially for adolescents that have like lose a lot of blood in menstruation, and they can sometimes need to take an iron supplement, or if they have some other condition that results in blood loss that can cause iron deficiency, or just having a diet that's really low in iron containing foods. The symptoms are kind of nondescript, so you would definitely need to check iron levels to really know this. But you'll see a lot of times people say, they're feeling tired or feeling cold. Can be kind of non-specific symptoms of low iron. Typically, if you have to treat low iron, they will do so with oral iron supplements. And this is another thing that's really key for your pharmacist to counsel on. So iron is very poorly absorbed, but it's also poorly tolerated. So it's very tricky, I feel like, to counsel and take. So they actually recommend to take it on an empty stomach, and taking it with vitamin C, that acidic environment can help increase absorption. So you take with vitamin C, take with a little bit of orange juice. I guess one of the problems though, what do you think if taking something on an empty stomach, what would you expect might be a problem? Yeah, GI side effects. So iron is notorious for causing a lot of GI side effects. So while we would love patients to take it on an empty stomach to help improve absorption, it is often not tolerated that way. So the common recommendation is for them to at least try it on an empty stomach. And if they can tolerate it, wonderful. Sometimes patients don't have any trouble. But if it's not tolerated, they're having a lot of GI effects, a lot of nausea, they can take it with food, but it can decrease absorption up to 50%, so quite a bit. But I always think, well, a little bit of iron is better than no iron at all. And if they feel horrible every time they take it, they're not going to take it. Sometimes they'll send prescriptions for iron to the pharmacy, even though it is over the counter. Have you guys seen it dose anything besides once a day in the pharmacy? Nobody? Yeah, so a lot of times it's actually dosed like every other day or just a couple of times a week. This is a relatively, like in the past, 5 years-ish, thing that they have done head-to-head trials looking at everyday dosing versus every other day dosing, and have found like similar absorption and efficacy and better tolerability So oftentimes providers will actually have patients take it every other day, and that can be another thing to help with tolerability. All right, a common counseling point for iron is it does turn the stools black. So that's very alarming for patients. Whenever their urine changes a different color or their stool changes a different color, it is cause for alarm to people. Just as a review, thinking back to your self-care days, what is some other medication that can turn the stool black? This is just free for the Twitter, free review. Pepto-Bismol, yeah. It's just so funny. I'll tell you a quick story because we have time. So one of my best friends, we were on vacation, and she was just like feeling nauseous. I don't know. She's a sensitive soul. She's feeling nauseous all the time. I feel like. And so she decided to take some Pepto-Bismol. It takes quite a bit of it. And then the next day, she's like, Heather, I know this is like a little bit too much information, but my poop this morning was like so black. And I was like, oh. At first I was like a little concerned for her as well. And then remembered that she had had quite a bit of Pepto-Bismol the day before. And I was like, oh, this is such a classic counseling point. Anyway, so hopefully when you're studying this, you'll be like, I just actually told a Pepto-Bismol story rather, by the iron slide, and you'll remember that it goes through. All right. I feel that way all the time when you learn about the side effects, but I don't know that you fully believe it until either you yourself have experienced it or someone close to you has experienced it. And you're like, wow, that side effect does exist. Like taking ibuprofen on an empty stomach. Wow. I feel death adjacent if I do that. And I'm like, I don't think I really believe them until I did it. Okay. So when you think iron, definitely think very poorly tolerated, poorly absorbed. They can try to take it on an empty stomach, but if they can't tolerate it, it is okay to recommend them take it. There are a lot of different iron products. What they consider kind of the gold standard that all the products are compared to is iron sulfate. So this one here. All the different amounts of types of iron have different amounts of actual elemental iron, so it can be a little bit confusing when trying to recommend your iron products. So you'll see the iron sulfate 325 is probably the most common increment for it to come in, has 65 milligrams of elemental iron. Unfortunately, only about 20% of that is absorbed, even if you're doing all the right things, taking it on an empty stomach, all of that. So a lot of times people still end up having to take like 2 to 3 tablets a day. So it's really not a fun medication, I feel like, to take. Some of these other irons, like ferrous gluconate, for example, your book will talk about some people tolerate some of them better than others, but I would say the most frequent one that you would see would be the iron sulfate. Okay, magnesium. Oh, you know what? One more thing back on the calcium thing that I just wanted to remind you on. Make some connections to other courses. What was something also that you learned in self-care that calcium products are used for? Tums. Did you say Tums? Yeah, they're used for heartburn and for Tums. I just wanted to make that connection too. Sometimes people will take like their Tums is calcium carbonate, I believe. And so sometimes people will take a Tum as like their calcium supplement. So I just wanted to say that. Okay, back to magnesium. Because magnesium also has a throwback to self-care. Does anyone remember what magnesium was used for in self-care? Oh, I think I heard it. A little constipation. Yeah, constipation. So really one of the main side effects of magnesium is diarrhea. So therefore, it's often used over the counter for constipation. And it's a fairly safe thing to use for it. In general, if people's renal function is good, any extra magnesium will just be cleared from the system by the kidneys. It's more of a concern if someone does have really poor renal function, then they could be at risk of magnesium toxicity. But in general, magnesium is pretty safe. You'll see here it's used for bone formation. So sometimes patients will take magnesium and they'll ask why they're taking it, and they're saying they're taking it to help support healthy bones. It's also something that's found in a lot of fresh fruits and vegetables. So something that most people can get from their diet. But you'll see that there are some reasons why people might be deficient in calcium. You'll notice our PPIs again, since they're affecting that acidic environment. Let's see here. Magnesium deficiency. I have seen some people with low magnesium levels. Sometimes it's due to being on like diuretics and things like that. Sometimes it's just unknown why people's magnesium is running a little bit low. So sometimes providers will recommend it be supplemented if we find that someone has low magnesium. It's something that is not in the standard metabolic panel. So if someone's worried about their magnesium, it has to be ordered separately. My mom takes a ton of magnesium, so I actually asked her to have hers checked. Her kidneys are fine, so her magnesium is fine, but it is something that would have to be checked separately. Let's see here. We talked about diarrhea. So I see a lot of patients on magnesium supplements for one reason or another. A lot of times people just take them on their own because they hear they're good for bone health and everyone wants strong bones. But I have a lot of patients that also have diarrhea too. So if I ever see that they're on magnesium and they don't really need it and they're telling me they also have diarrhea, it's one of like the first things that I'll say, well, let's try and get you off this magnesium as long as their magnesium is fine. And that can sometimes clear that up. Phosphorus. Let's see here. Study things about phosphorus. More up here on this second thing. I think one thing that comes up a lot with phosphorus is that it's used in end-stage renal disease. These are actually prescription use, though. Have you guys learned about phosphate binders in probably in renal? That would be where you would learn end-stage renal disease. So I more often see phosphorus being used to treat excessive phosphorus versus people actually having a deficiency in phosphorus. So this is more treating high phosphorus levels. But people can be deficient in it, although generally we get enough in our diet that we do not need to supplement phosphorus. I cannot recall like any patient that I've seen that's been on a phosphorus supplement independently. So it is kind of a rare thing to see. That was not all the minerals. If you have your OTC non-prescription drug book, they have a couple more things in there. You'll also hear about some of these when we talk about different disease states. So I know P2s will talk more about calcium and vitamin D. When you do renal, they'll talk a lot about these things too. But this is more from the lens of an over-the-counter approach. I think big take-homes I want you to kind of keep in mind about vitamins and minerals is very rarely do people need to supplement them, especially if they have a diet and they're getting a fair number of fruits and vegetables. This is the same even with multivitamins. We didn't talk about multivitamins specifically. They normally have a bunch of the different vitamins and minerals we talked about. Research suggests that most of us are getting all of these in our diet without a multivitamin. I think the multivitamin industry has done a really good job marketing themselves to make people feel like they need a multivitamin, but a lot of people don't. But there are certain populations that really do. So bariatric surgery, for example, they're recommended to be on a multivitamin for life. Other different conditions too, it might be recommended. But if you're trying to partner with patients to help conserve their resources and reduce pill burden, and they're taking a lot of vitamins and minerals, It's definitely up to them, but this might be a place where you can help them reduce their pill burden if they're not really low in that specific thing. There's definitely plenty of times when people are low in things like B12, we talked about folic acid. There's definitely lots of legitimate reasons and indications for vitamins and minerals. But if it's not actually low or they don't have that condition, then supplementing it is not necessarily giving them any benefit. So I think that's a big take home. Because I think there's a lot of marketing and philosophy that, oh, a little extra vitamin C is good for you. And it might not harm you, but it's not always going to be helpful either. And then, let's see, avert deficiency is very rare. And then excessive use of supplements, or even use of vitamins and minerals not at excessive uses can have some drug interactions and side effects. So always important to ask patients about it. And always important to put these in your drug interaction checkers when you are on rotation seeing patients, or if you're in the pharmacy and patients ask you about the safety of a vitamin and mineral. Always put them in those interaction checkers. Because I don't know all the interactions off the top of my head, and you probably don't either. We might have some of the main ones, but not all of them. All right. Thank you guys. We're out early, right? Yeah. So I think since we are out early, what I would recommend is you have like a little take-home quiz-ish thing, homework, if you will, that's due before the next class period. So maybe go ahead, open that up on Brightspace, go ahead and take that. I think it's there to help you solidify some of the main points and to prepare for the type of question that would be on this for the exam. Thank you.
Are you available?